What if I told you some of the very medicines you trust every single day, the ones sitting quietly on your bedside table, could be slowly affecting your memory? Not overnight, not dramatically, but little by little, causing confusion, forgetfulness, even increasing the risk of dementia after 60. I've seen this happen, real patients, real stories, families thinking it's just aging, when in reality, something else was silently playing a role. Many people have no idea. As we get older, it's completely normal to rely on medications. Blood pressure, sleep, allergies, pain, these are common issues, and medicine helps us live better. But here's the truth we don't talk about enough. Some medications, especially when used long-term or combined, can affect how your brain works. This doesn't mean you should panic or stop anything suddenly. Absolutely not. But it does mean you should be aware. Today, I'm going to walk you through 9 common medications that may quietly impact memory and increase dementia risk after 60, and more importantly, what you can do about it. Let's go step by step. These are medications used to help you fall asleep, like sleeping tablets or night pills. Why is this a problem? Because they slow down brain activity, and over time this can affect memory, concentration, and alertness. I once had a patient in his late 60s. He started taking sleeping pills for occasional insomnia. Months later, he complained of confusion during the day, forgetting simple things like where he kept his keys. People think, it helps me sleep, so it must be safe. But long-term use can make the brain dependent and less sharp. Try improving sleep naturally, regular sleep schedule, reducing screen time, light evening meals, and if needed, use medications only under strict medical guidance. These are very common, used for sneezing, runny nose, itching. Many older antihistamines can block a chemical in the brain called acetylcholine, which is essential for memory and learning. Someone takes allergy medicine daily during seasonal changes and starts feeling mentally foggy without realizing why. Over-the-counter means harmless. That's not always true. Ask your doctor about newer, non-drowsy antihistamines. They are much safer for brain health. These are often prescribed for stress, anxiety, or panic, and they work by calming the brain. Yes, but over time, they can dull brain function. I've seen patients become more forgetful, slower in thinking, even emotionally flat. People start relying on them daily instead of addressing the root cause like stress or lifestyle. Combine short-term medication if needed with relaxation techniques, breathing exercises, walking, social interaction. These are powerful and safer. These are used for severe pain after surgery or chronic conditions. They affect the central nervous system, slowing down brain signals. An older adult using strong painkillers for joint pain starts experiencing confusion, especially in the evening. The brain becomes less responsive, especially when combined with other medications. Better advice? Use the lowest effective dose and explore alternatives like physiotherapy, mild pain relievers, or lifestyle changes. These are commonly used for urinary urgency or incontinence. Many of them also block acetylcholine, the same memory-related chemical we talked about earlier. A woman takes bladder medication for months, and her family notices she's repeating the same questions again and again. These medications are often taken long-term without review. Better alternative? Pelvic exercises, fluid timing, and discussing safer options with your doctor. Not all antidepressants are harmful, but some older ones can impact memory and thinking. They alter brain chemicals, sometimes too strongly in older adults. Example: a patient feels emotionally better, but starts struggling with focus and recall. Hidden misconception? If it improves mood, it must be good for the brain. Not always. Better. Approach: modern antidepressants are usually safer. Always review with your doctor which type you're using. These are used for heartburn and acidity. Now, occasional use is fine, but long-term use can lead to vitamin B12 deficiency. And B12 is critical for brain health. Real-life case: someone takes acid medication daily for years and slowly develops memory issues due to low B12. Hidden risk: the connection is often missed because symptoms appear gradually. Better advice? Use these medications only when necessary and check your vitamin levels regularly. Some blood pressure medicines can cause dizziness or reduce blood flow to the brain if not properly adjusted. Why is that a problem? The brain needs a steady blood supply to function well. An older adult feels lightheaded and experiences confusion after standing up quickly. Hidden issue? Dosage may be too strong for the individual. Better solution? Regular monitoring and adjusting medication based on your body's response. This is probably the most important one. Taking multiple medications together, even if each one is safe, can create unexpected effects. The brain becomes overwhelmed. Real life example, an elderly patient taking 5 to 6 medications daily starts showing signs of confusion, not because of one drug but the combination. Hidden danger? Doctors may prescribe different medicines without reviewing the full list. Better approach? Always review all your medications with your doctor at least once a year. So here's the truth. It's not just one medication, it's the pattern, the duration, the combination, and how your body reacts after 60. Memory loss and dementia are not always just aging. Sometimes they're signals, whispers from your brain asking for attention. But here's the good news. With awareness, careful use, and regular checkups, you can protect your brain. If you or someone in your family is over 60, take a moment after this video, look at the medications you're using. Don't stop anything suddenly, but do ask questions. Because your brain, your memories, your identity, they matter. If you found this helpful, share it with someone who needs to hear this today. And remember, growing older is natural, but staying mentally sharp, that's something we can actively protect. Take care, and I'll see you in the next video.